Hello and welcome to the part 2 series of hospital pharmacy and its organization. The learning objectives of part 2 session would be, upon completion of this session, you should become thorough and you should be able to understand and define about location and layout of hospital pharmacy, flowchart of material and men, requirements of personnel for successfully running hospital pharmacy, facilities required for pharmacy in hospital, requirements of equipments for hospital pharmacy, requirements and abilities required for hospital pharmacist, various departments and services provided by hospital. Firstly, we shall understand the location and layout of hospital pharmacy. The location of hospital pharmacy should be such that it should be very convenient to the public, so that each and every department is well connected to the hospital pharmacy and such services can be rendered by hospital pharmacist with utmost ease. It should be situated probably in the ground floor or the first floor, and we should be well connected to the all departments including nursing station. It consists of typical sub-departments like inpatient, outpatient department. Inpatient is also called to be as indoor patients, indoor, outpatient, outdoor, manufacturing, dispensing and store. Here we can see the typical layout of hospital pharmacy, where we can see the medical stores on the top ladder, which is connected to the IV fluids and other manufacturing services. And we can see in the middle, that is hospital pharmacy, is interconnected to the all departments, whether it may be the IV fluid manufacturing area or other manufacturing services and quality control. And hospital pharmacy is connected to the both departments, that is inpatient services and outpatient services. So this is the typical layout of hospital pharmacy, and this layout will explain how the hospital pharmacy is interconnected to each and every department, whether it may be the manufacturing services or whether it may be the medical stores, whether it may be the quality control department to check the quality of the product, and whether it may be the inpatient services and outpatient services. So they are the centric located, they are located at the center and they are interconnected to all departments for the smooth functioning of the hospital. Now let us move further and let us understand the further about for inpatients. Doctor, they prescribe medicines and nurses dispense the medications to inpatients. So inpatients are those category of the patients who get admitted to the hospital because of some severe or major diseases or disorders. Now we can see a tree diagram of dispensing medicines to inpatients in hospital as hospital pharmacy, a tree diagram which shows about dispensing medicines to inpatients, how the dispensing medications will go in the hospital to the inpatients, how it goes from one department to other department, from one pharmacy to the other pharmacy. From hospital pharmacy, it goes to the satellite pharmacy, dispensing medicines. From there, from satellite pharmacy, the medicines may go to ward pharmacy. From ward pharmacy, it reaches to the inpatient department. The role of satellite pharmacy is to collect medicines from pharmacy and dispense to the ward pharmacy. So satellite pharmacy, it collects medicines from the hospital pharmacy and they dispense medicines to the ward pharmacy. The ward pharmacy is controlled by nurses, where drugs are prescribed and dispensed to the inpatient. So we can see the ward pharmacy here. So they collect the medicines from the satellite pharmacy, and this ward pharmacy is mainly controlled by the nursing team, where they are giving prescription to the and they dispense the medication to the inpatient department. We can see the nursing department, nursing station, including the doctor. Now we shall move on to the outpatient department. So outpatients are the name itself is outdoor patients or outpatients are said to be they are not having that much problems. They just go, they come to the hospital and they meet the consultants and they can just go to the homes. They are called to be as outpatients. So no need of getting admitted to the inpatient departments. They are not severely or critically ill patients. It is located to near outpatient department and it may be near to the casualties. This department is well furnished, which gives pleasant look and provide proper sitting facilities for waiting patient. The waiting place can be used to educate the waiting patients and relatives about medications, such as various charts and models will be displayed showing about various activities which is taking place in the hospital and some of the informations which may be given and displayed in the hospitals, like vaccination programs, importance of family planning, importance of blood and eye donations, preventive measures for various infectious disease like AIDS and TB, tuberculosis. Now let us move on to the from inpatients to the manufacturing unit. The pharmacist manufacturing own bulk drugs like sterile and non-sterile in the hospitals. The sterile preparations may be like large volume parenterals, small volume parenterals, etc. The advantages of this unit are economically cheap, less time consuming, and having better quality control. It is present nearer or attached to the hospital pharmacy. Preferably, it may be suited at the ground floor or basement of the hospital. Hospital pharmacy receives supply of materials either outside or inside manufacturing unit. Initially, supplied medicine come to the hospital pharmacy and go to the quality control department, where quality of the medicines will be checked stringently, and again come to the pharmacy department. Then medicines may be supplied to the inpatient or outpatient as per the need. Now we can see the floor space requirement for the hospital pharmacy. So the requirement of the floor space may be different for different area. First we can see the serial numbers here, 1, 2, 3, 4, and here we can see the functions. There are different sections are there. And here we can see on the top ladder area requirements as per the bed strength, which is in square feet. And here we can see 100 beds, 300 beds and 700 beds. And for dispensary, as per the area requirements, as per the bed strength, which is in square feet, the minimum area required is 350 square feet. Okay, if it is 100 bed hospitals, they should have 350 square feet for dispensary. The area allocated for 300 beds is dispensary area. I'm speaking about 500 square feet. As the beds are increasing, the square feet is, it is double now. 500, almost 800 square feet is required. Dispensary section 800 square feet of dispensary section is required for 700 bedded hospitals. In the similar way, preparation room for 100 beds, the requirement is 100 square feet. Preparation room requirement for 300 bedded hospital is 400 square feet. Preparation room requirement for 700 bedded hospital is 650 square feet. Storeroom requirement is 450 square feet for 100 beds and 1000 square feet for storeroom is required for 300 beds and almost around 2400 square feet is required, storeroom is required for 700 bedded hospitals. And manufacturing of pills and compressed tablets, if it is carried out, it is not carried out in 100 bedded hospital and 300 bedded hospital, it may be carried out in 700 bedded hospitals sometimes. Capsulation, same thing, it is not carried out in 100 and 300 bedded hospitals, but it may be carried out in 700 bedded hospitals and area required for capsulation is 200 square feet. Manufacturing under aseptic conditions, especially for eye drops, eye lotions and other preparations for external use. 100 bedded hospitals, there is no manufacturing area is required. And for 300 bedded hospitals and 700 bedded hospitals, it is 250 square feet and 250 square feet, same area which is required for manufacturing under aseptic conditions, which may be eye drops, eye lotions and other preparations, which is meant for external application, external use. Repacking operations, both in 100 bedded hospitals and 300 bedded hospitals, nothing is required, and the minimum requirement for, as per the bed strength for 700 bedded hospital is 300 square feet. Parenterals, and for 300 bedded hospitals it is 600 square feet area, and for 700 bedded hospital it is 600 square feet area. Both are same. And total area in square feet, it is almost 1010 square feet for 100 bedded hospital, and for 300 bedded hospital it is 2900 square feet is required, and for 700 bedded hospital it is almost 6300 square feet is required. So average area per bed in square feet, if you take, it is almost 10 square feet, and it is, as per the bed in square feet, it is 9.6 and it is 9 square feet. So this is the typical requirement of space for hospital pharmacy. Now we can see the flow chart of man and material, how it goes. The flow chart goes and starts from the medical stores or outside manufacturing unit. From there, it goes to the medicine and other supplies. From there, it is very well interconnected to the receipt department, where receipts and other things, the vouchers and other things will be taken care, where the receipt department, some of the commerce graduates or some of the accountants may be handling all and operating all these procedures for proper maintenance of receipts and documents. From there, we can see it is connected to the hospital pharmacy manufacturing unit, and where we can see other department which may be working, and that is non-sterile supplies and the steriles preparations, which is prepared in bulk amount, like parenterals and large volume parenterals, small volume parenterals, or the eye lotions and the other things which is aseptic preparations will be prepared. And we can see the hospital pharmacies located at the center. So hospital pharmacy is interconnected to the all departments now. Now there is outpatient pharmacy. From outpatient pharmacy, it may reach to the outpatients. Below the hospital pharmacy, we can see here the quality control departments, and these quality control departments' main work is to check the quality. They inspect the quality and they will pass on that product is up to the mark. So they are like quality control department to assess the quality, to check the quality of the pharmaceutical products. From there, we can see the ward or satellite pharmacy. It goes to the ward and satellite pharmacy. From there, the nurses are the department, a nursing team will dispense the medication to the inpatient department. So this is the typical flow chart of material and men, how it functions in the hospital pharmacy department. Now we shall try to understand the requirements of personnel for pharmacy. All members of pharmacy shall be competent enough, and they should have the good moral character, which is one of the strong foundation for any person who does the healthcare activities. And he should be physically and mentally fit to perform all the duties which is given to him. The list of persons required in pharmacy, we will see one by one the different lists. Smaller hospitals, they may require only one pharmacist who is carrying out all the responsibilities which is on his shoulders. Whereas in larger hospitals, they may require more number of pharmacists, and this selection is usually done based on the qualification. I mean, which specialization is existing. Some hospitals in abroad, they may look certain qualifications. So in India also, they may look qualifications like B.Pharm with M.Pharm pharmacology or pharmacy practice will do, Okay, and they should be having particular interest and particular expertise in particular area. So these pharmacists may be expert in one or more fields. That means that they may carry out different activities or different tasks given to them. Sometimes during some period of time, they may be involved in the sterile supply. They may be working with sterile department, and they may be working as pharmacy managers. So different activities will be given to a pharmacist, to the same pharmacist, depending upon the requirement. So number of pharmacy staff members, it depends on the number of beds in the hospital, the scope of services which they can provide to inpatients and outpatient services, activities of pharmacy, whether it is involved in manufacturing of drugs and other formulations. Now we shall see the list of the personnel required in hospital pharmacy are as follows. We can see the different list and the different cadres, the hierarchy. First, we can see here the director of pharmacy and associate director under director, and there are 2 to 3 assistant directors to assist associate directors. So all these persons are highly qualified. They'll be having the qualification PG in pharmacology and sometimes the pharmacy practice with minimum experience. Now, chief pharmacist should be, he should be having a graduation, B.Pharm, and under him, assistant chief pharmacist who is having diploma in pharmacy. And all these operations will be carried and they should be registered as a pharmacist in PCI. In particular state councils, they should become registered pharmacists. Then only they can be selected for these positions. Now, next, the staff pharmacist completing some nursing courses and non-professional trained pharmacy helper. And below that, there will be the clerical staffs will be there for clerical working and other things. This is the list of personnel required in hospital pharmacy. Now we can see the same thing which I have classified here in this manner as per the qualification. PharmD, M.Pharma, nowadays they are opting for PharmD, M.Pharma in pharmacology and pharmacy practice. We can see all the 5 ladders here. Now the director, associate director and assistant directors, they should have minimum qualification of M.Pharma or PharmD. And for registered pharmacist, their name should be entered into the state pharmacy councils as per the PCI, and they are chief pharmacist and assistant chief pharmacist. And for chief pharmacist, minimum qualification is B.Pharm, as I told you, and for assistant chief pharmacist, the minimum qualification would be D.Pharm, and they should be registered pharmacist. Staff pharmacist, any courses or completed nursing courses will do. Non-professional, and they are coming under the trained pharmacy helper, and they are coming under the category of non-professional. Up to here we can see professionals. Here there are non-professionals, and clerical duties and other things, a clerk is involved in doing all these type of things. Now we shall move on to the facilities which is required for pharmacy in hospitals. Adequate pharmaceutical and administrative facilities shall be provided for better running of pharmacy. We can see one by one. Suitable equipments for compounding, dispensing and manufacturing of pharmaceutical, sterile and non-sterile products. Supply of necessary bookkeeping, stationery, furniture, material and equipments for proper administration of the department. And adequate library and filling facilities to make the information on the drugs readily available to both physician and subordinate pharmacist. Adequate locking arrangements for proper storage of Schedule X category drugs like narcotics and alcohol preparations. Sufficient floor space with proper lighting and ventilation should be provided for adequate storage of pharmaceuticals and other operations of the pharmacy. A refrigerator for storage of thermolabile products like cold chain preparations has to be kept in the refrigerator. So a good refrigerator is required for proper storage. Now we shall move on to the requirements of equipments for hospital pharmacy, various list of requirements of equipments. They may be classified into two categories. One is administrative materials and equipments, and other one is professional materials and equipments. Coming to the administrative materials and equipments, we can see here administration purposes, which all the materials and equipments are required for the administrative purposes. Bookcases, wooden metal desks, lockers should be available, work tables, filling cabinets, notice boards, clocks, calculators, computers, cash registers and stationery items. These are all items which are required for administrative purposes. Now we shall see the professional materials and equipments. Work tables, weighing machines, water distillation, balances, mixing tank, homogenizers, tablet capsule, fluid manufacturing equipments, pressure vacuum pump and sterilizing equipments. These are all the materials and equipments for professionals which is required for professional things. So the requirements of equipments for hospital pharmacy can be classified into administrative and professional materials. Now we shall see the requirements and abilities required for hospital pharmacist. These are the various requirements for hospital pharmacist. As per the Hathi committee, which has recommended that IV fluid manufacturing should be done under the supervision of M-Pharm, assisted by B-Pharm and D-Pharm holders. Now we can see the flow chart for requirements of hospital pharmacist. On the top ladder, we can see the director. Below the director, there is a superintendent of pharmaceutical services or chief pharmacist who may be PharmD or M-Pharm. And below the superintendent of pharmaceutical services or chief pharmacist, there is a pharmacist who is meant for drug distribution department, one who is having the qualification of B-Pharm. And under chief pharmacist, there is one more pharmacist. He is again leading the team. There may be two pharmacists who may be B-Pharm or D-Pharm. And for postgraduate, he is required for quality control departments. Especially, they may go for the M-Pharma in pharmaceutical technology and Sutix. So this is the flow chart for the requirement of a hospital pharmacist in various departments. Now we shall move further and we shall understand the abilities for hospital pharmacist. What all the abilities a hospital pharmacist should have. Hospital pharmacy is a department where we have seen the procurement of the drug will take place, storage of the things has to be done in a proper manner, dispensing of the drugs is the utmost prime function of the hospital pharmacist, which has to be maintained and which has to be done as per the good pharmacy practice guidelines. Manufacturing and preparation of sterile and non-sterile preparations. Distribution of medicines to the inpatients and outpatients. And lastly, the hospital pharmacist should be always keep himself updated in case of, and he should have thorough information regarding about drugs and disease. Because of various functions, the abilities of pharmacist we can see one by one. One, he should have the knowledge, the sound knowledge about drugs and their action. They have to, the hospital pharmacist should develop pharmaceutical manufacturing program. He should have the ability to develop and conduct the manufacturing program. He should have ability to run drug information centers. He should be having ability to store drugs as per the regulations, guidelines. He should have ability to undertake manufacturing of various preparations which is there. in the hospitals. He should be having ability to available right drugs. It becomes utmost duty of the hospital pharmacist. The right drugs should be made available at right time and without compromising the quality, and it should reach the patient with least possible cost. He should have ability to train new pharmacist who is joining to the hospital. He should have ability to coordinate and cooperate with other departments. So the pharmacy department may work in coordination or liaison between different departments in the hospital. So these are the various abilities for hospital pharmacist. He may be having different kinds of abilities. He should work with all these things in proper coordination. Now we can see the various departments and services provided by the hospitals. 1. The medical staff. It consists of following groups. One is the honorary group, that is honorary staff, consulting staff, active staff, and associate staff. Here, coming to the honorary staff, this honorary staff, the physician who are active in hospital during work and retired from hospital job. Okay, but giving honor because of outstanding work which has been performed by them. They are called to be as honorary staff. Next, consulting staff. These are the various kind of specialities from various facilities. They may be coming on consulting hours on specific days like Monday or Saturdays. They may become like consultants, specialists from various departments like oncology, radiation consultants, or some internal medical doctors, internal medicine doctors. Active staff, actively involved in hospital to take care of patients, so they will be available around the clock. And associate staff, group of juniors and less experienced members. They are called to be as associate staff for active staff members. Now we can see the various services of the hospital is again divided into two groups. One is the clinical services. Clinical services, we can see it is further divided into various clinical service departments, and each department has head of the department, HODs. So there may be head of the department for each department: medicine department, general surgery, orthopedic, gynecological department, ENT department, ophthalmology department, anesthesia department, psychiatry and nervous system department, tuberculosis department, pediatric, and so on. So each system will be headed by HODs, head of the department doctors, and under him the consulting staff, the active staffs and associate staff will be working under him. Next we can see the supportive services. One is supporting. It is important services of hospital, and without these services, the clinical services not able to run hospital smoothly and effectively. They are required for the hospital. They are called to be as supportive services. The supportive services, which includes nursing services, it is under direct control of director or the superintendent of nursing. It is very important in hospital for following reason. It covers health promotion, care and prevention of diseases. It gives emotional support, counseling, and teach the patient. So we can see the nurses are available round the clock for giving patient care. There is one more services which is there, that is called to be as dietary services. This department is controlled by a qualified person, one who is expert in the nutrition and the dietitian. This department provides palatable and appropriate amount of food using principles of science of nutrition. It is responsible for recording dietary history of the patients, whether the patient is allergic to certain types of foods. They give a specific diet to specific patient depending upon the different disease. A different diet is given for hypertensive subject, different diet is given for renal impairment subject, different diet is given for obesity patients or any type of ailments. Different diet is chosen based on their disease perspective. Next, we can see the medical record services. This department records all the significant clinical information which is supplied to the physician whenever it is required. Next, we can see the pathology department where the pathology services may be given. There may be a head of the department, and under him there are specially trained persons. Sometimes the lab technicians will be working. These they perform the duty. They collect the blood samples or urine specimens, feces, sputum and semen, and they may be analyzed for the presence of specific microorganism and other constituents. So the pathology department is one of the main department which is giving many information to the clinical services. Lastly, we can see the blood bank services. In the blood bank services, blood we can see which is one of the important lives saving therapeutic agent. Most of the hospital operate blood bank under pathology department, so they may be working under pathology department. This department is controlled by the licensed physician. So these are the various services of the hospital. Okay, first it is mainly divided into two types: the clinical services and supportive services. The clinical services we can see different department systems will be working, different classification of systems, different departments, specializations. And under supportive departments, this act as a supportive department for clinical services. This should go hand in hand, whether it may be the nursing department, dietary services department, medical record services department, pathology department, or blood bank services department. That completes the hospital pharmacy and its organization. Thank you.